make sure you talk to the PA about school. I know you haven't been doing as well. You used to get the hundreds.
Mom, I got a 90.
No, but you used to get the hundreds. Now you have all these stomach problems, and I know it's related to school. We should definitely speak to the PA about this.
No, Mom, I'm fine. I'll go in by myself.
No, Rima. I want to talk to the PA, and I want to hear what she has to say, okay?
Fine, you can come.
Rima, we're ready for you. This way, please.
Come in.
Hi, I'm Samantha Hallerman. I'm a physician assistant. Are you Miss Patel?
Oh, I'm Madhumala. Nice to meet you.
Hi. Nice to meet you.
I'm Rima.
Nice to meet you. So what brings you in today?
You know, Rima, she's been having a lot of stomach pain recently, and I think it's with stress with school. And, you know, she hasn't been doing as well.
Okay, I'm sorry to hear that. Can you describe what's happening to me?
Well, my stomach hurts.
Okay, can you tell me a little bit more about that?
Well, it started a few days ago, and it's been getting worse. I don't remember exactly what I was doing when it happened, but it started suddenly.
Oh, and you also have a fever. I've been giving her some herbal medications like turmeric powder.
Okay, I've actually never heard of turmeric powder. Can you tell me a little bit about it?
Oh, you know, it's an antioxidant. In my culture, we do a lot of and use a lot of herbal medications, and I know someone who has taken it before and it's worked for them.
Okay, do you feel that it's been working for you?
Yeah, I think it is working.
Okay, so let me get this straight. You've been having stomach pains for a few days, and it started suddenly, and you've been taking the herbal medicines, that's it, and it's been working for you? Is that correct?
Yeah.
Okay, are there any other concerns?
No, not at all.
All right, so we're gonna actually have Mom step out of the room for this part of the interview.
Oh, don't worry. I was a nurse back in my country. I know everything that my daughter has.
Mom.
What's wrong? What do you have that I don't have?
Don't worry, this is just part of the protocol. We do this with all of our patients.
Okay. I mean, if you say so. Oh, Rima, don't forget to tell her about your eyes, okay?
All right, now that Mom isn't here, is there anything else you'd like to talk about?
No, not really.
Listen, anything that we talk about here is confidential. You can feel comfortable. Anything you tell me won't be shared with your mom or your parents unless you give me the okay.
Okay.
All right, so how is school going?
Well, it's going great, but my mom is just worried because I don't get hundreds anymore. I get 90s.
I mean, I understand the concern, but you know, 90s are still great. You should be proud of yourself. So tell me about your friends. Do you have a good support system at school?
Yeah, I have 2 best friends, and I get along with all of my classmates.
That's great. I'm glad to hear that. Are you seeing anyone? Do you have a boyfriend or a girlfriend?
Yeah, I have a boyfriend. He's a senior.
Oh, okay. How long have you been dating him?
3 months.
Okay, that's a long time. Well, so listen, I have to ask you this. I ask this to all of my patients, okay? Are you currently sexually active? You know that means either oral, vaginal sex, or anal sex.
Yeah, vaginal and oral sex.
Okay. Are you guys using any protection, such as condoms?
Sometimes.
Okay, well, we do recommend that you use condoms every time, okay, for every sexual encounter.
Okay, well, while we're on that topic, I've actually noticed some fluids coming from down there.
Oh, okay. Do you have any other symptoms along with that?
Yeah, it also smells bad within my vagina, and when I'm having sex, it's bleeding and it hurts when I pee. And there's also blood in between my periods.
Okay, so based on that information, I'm gonna have to perform a pelvic exam, and then we'll get to the bottom of this and we'll see what's going on, okay? All right, Rima, based on the findings of our physical exam, I'm afraid I have to tell you you've contracted an STD.
What?
I know this is surprising news, but the STD led to pelvic inflammatory disease, and that's why you have the abdominal pain and the pelvic region symptoms you were experiencing. It's all right, Rima. I know, I understand how upsetting this could be. But listen, we found this early, and it's very treatable, okay? So you'll be able to get better soon. I can give you antibiotics. You need to take them for the full duration, okay? And like I told you before, everything we've talked about here has been confidential, but I have to tell you, I do recommend that you tell your mom about this. I know that's going to be hard, but I can help you, okay? I can help you tell her.
Kill me.
I know, but hopefully me and you together, we can tell her and we can figure out a way that you guys can deal with this, okay?
Oh, come in.
Hi, so it looks like you have abdominal pain.
You know, my daughter, she's been having stomach pain and it's been hurting her for a while. And I really think that it's related to stress.
Oh, you know what? Hang on one second. I need to take this. It's very important. Hello? Hey, what's up? Oh, no, I'm at the hospital. It's fine. It's not a big deal. Yeah, tomorrow night works really well. Yeah. All right, great. I can't wait to see you. All right, bye. Okay, sorry, what were you saying?
You know, my daughter, she's been having some abdominal pain and it's been going on for the past couple of days. I really think it's related to stress from school and I always tell her to take it easy, but I really don't know what's going on and her grades are just not as good as before, so I'm really, really worried.
Okay, so you're stressed, or are you having panic attacks too?
No.
Headaches, nausea, vomiting, all that kind of stuff?
No.
Well, I don't know. I mean, it sounds like anxiety. You should just take it easy. It's really not a big deal. You'll be just fine.
You know, CD, I told you it was nothing.
Yeah, you know what? If you want, here, let me give you a prescription for an anti-anxiety medication. Just take this, you know, you'll feel better in no time, okay? Here you go.
Thank you.
Okay, Rima Patel. Abdominal exam within normal limits. Pelvic exam, done. Normal. Diagnosis. Anxiety. That's what I'm going to say.
So here's what we learned in the making of our video. Use the mnemonic LEARN when interviewing cross-cultural patients. This stands for listening to the patient's beliefs and concerns, explain your own understanding and beliefs, acknowledge and explore the differences between you, recommend treatment, and negotiate an agreement. When interviewing an adolescent, be sure to direct the questions directly to the patient. Use open-ended questions to allow them to speak freely. Establish confidentiality, and be genuine. Also, proceed from less intimate to more intimate questions. When breaking bad news, use the mnemonic SPIKES. This stands for settings, perception, invitation, knowledge, emotion, and then summary and strategy of how you're going to deal with this. Some tactics of empathy that we use were validating the patient's feelings, active listening, reassuring the patient, reflection or repeating back what the patient's saying to make sure you understand, and just supporting the patient. In our skit of what not to do, here are some examples. Not actively listening, didn't act as traffic cop, or didn't interrupt the family member when they were speaking, used leading questions, didn't actually do a physical exam even though they reported it, so false reporting, not being empathetic, not explaining the prescription that you're given. Hope you guys enjoyed our video.